Good morning, good evening, good afternoon, doctors, nurses, and pharmacists. I'm DrChe, and today we will discuss very important writing and reading tips for doctors, nurses, and pharmacists. Okay, so let me share the session with other doctors and nurses, then we will start. Okay. So we will discuss reading tips for part A, for part B, and C also, if possible. If you can share the session with other doctors, nurses, and pharmacists, that would be great. Okay, so part A, today's topic is leptospirosis. Just let me share the session, then we will start. Okay. If you can hear me, just please let me know. If you can hear me, let me know in the chat box. Okay. And if you can share this session with other doctors, nurses, and pharmacists, that would be great. Okay. Okay, let me see. Okay, Dr. Khalid can hear me, Dr. Sajid, Miss Radha, Miss Homa, Miss Shanti. Okay, so 20 people. Miss Madiha can hear me. Okay, thank you, all of you. Okay. Just 1 minute, let me share the session, then we will start. Okay. This is the text. Let me open the questions here. These are the questions. Let me tell you one thing, that mostly in part A, in reading part A, you will get common topics like diabetes, like hypertension, like, you know, some tests like, for example, lumbar puncture, anemia, snake bite. Okay, so these kind of things. Okay, mostly common topics that most of the doctors, nurses, and pharmacists, they already know these topics. Okay, actually the main thing that they want us to do is, in part A, is time management. Time management. Okay, so time management is very important. You should try because you have 20 minutes, sorry, 15. Okay, so you have 15 minutes for 20 questions. Okay, so this is very short time. Mostly the questions are easy, but almost 10 questions are very easy. 4 or 5 questions would be a little bit difficult. Then 4 or 5 would be a little bit, more difficult to check whether you can pass the reading or to assess your reading abilities. So you need to be careful. Even there are some easy questions, some tricky questions would be there to check whether you can uh, pass the exam or not. Okay. Okay. So what is strategy for part A? First, we need to skim and scan the text. Skim and scan the text. Just see the headings, subheadings, main points. Okay. What is in each text A, B, C, and D. Then we will go to the questions and we will try to solve the questions. Okay. For example, today's topic is leptospirosis. Okay. Is there anybody who don't know what is leptospirosis? What I want to say is mostly in part A, you will get some easy topics. Okay. Easy topics. Okay. So now first let us skim and scan the text. Leptospirosis is a rare bacterial disease, also called as Wills disease. Okay, that affects human and animals caused by bacteria. Two types, mild and severe. We don't need to read the details in mild and severe because when there is need of, there is relevant question, we will read it. Okay, mild, severe, and then here is just overall general information. You leptospirosis prefers which type environment, slow moving, water, incubation period, 80% of dogs, okay, leptospirosis shed in urine, okay, leptospirosis azotemic, more than 2 or 3 hours, hyperuremic, fatal leptospirosis, survival rates, dog in urban areas, and phase of leptospirosis, okay. So these are just, this is a picture and these are types and here in general information. So there would be some questions about this. Okay. Then we have pathophysiology. Pathophysiology, how we develop leptospirosis disease. Okay. So how it is transmitted, how we are affected. Okay. Like how it is transmitted, the cycle and these things. Okay. Can invade non-intact skin, mucous membranes coming, okay. So acquired coming in contact with, urine, contact with contaminated soil and water. Okay, historically this and that. In United States, this and that. Against very shed in infected animal urine. Okay, 16 days, 20 days, 24 days. Okay, inhaled, transmitted across the placenta if infected human is pregnant, leading to a miscarriage in the first 2 trimesters. During the third trimester, pregnancy can result in stillbirth or intrauterine death. Okay, once within body, then what happens? It goes to bloodstream, all of these things. Okay, so it takes 1 or 2 weeks for infected person to show symptoms. Then we have history and physical examination. History and physical examination. Leptospirosis can present, okay, can present in two distinct clinical forms, icteric and anicteric. Okay, two forms, icteric form and anicteric form. Okay, anicteric form is self-limited. Once it, okay, so just we need to quickly skim and scan the main things, not go into detail, the main things. Okay, onset is sudden. Okay, these are the symptoms, illness a few days. Okay, rarely fatal, 90% document case of leptospirosis. Anicteric, okay, syndrome. Okay, this syndrome is again they are writing about anicteric syndrome. Several days later, recurrence. This is recurrence. Okay, the patient will recover after suffering from chronic episodic headaches. The ectatic phase of leprosy is also called as Wales disease, severe infection, jaundice, respiratory, CNS, muscles, all of these things. Then is the treatment. Treated with antibiotics and supportive care. Okay, and treated early and aggressively, the chances of recovery. So then, current available vaccines, at least 12 months, annual vaccination, risk of infection in your family. There is still some risk. Okay, so these are things that we need to do. Protect yourself. Okay, administer antibiotics, avoid contact. Okay, if your dog urinates in your home, okay, what to do? Encourage your dog to do this and wash your hands, okay, after handling pets. Okay, this is the quick skimming and scanning of text A. Now let us go to questions. Okay, so question number one is, where a pet should urinate? In which text it is possible? In which text it is possible to find the answer where a pet should urinate? In which text it is possible? Okay, write your answers in the chat, please, quickly. Where a pet should urinate? In which text it is possible to find the answer? In which text? Quickly, please, quickly, don't waste your time. Quickly, text A, text D, okay, anybody else? Text A, okay, anybody else? Please, quickly, quickly. A, Miss Radha A, Miss Asma A, Miss Kavita A, Miss Huma D, and other Miss Huma also D. Okay, so most of you are saying A. Okay, so let us go for A. This is your text A, and try to find the answer where a pet should urinate. Okay, here there is no mention. This is type of mild spirosis, severe leptospirosis. No mention where a pet should urinate. Okay, try to find here. If you can find, let me know. Otherwise, we can change the text. Try to find here. Okay. If you can find the answer, please let me know. If not, we can change the text. If you can find the answer, let me know, please. Otherwise, we can change the answer. Where is the answer? If you can find the answer, where is the answer? Here, here, here. Okay, in which box? Quickly, please. Where we can find the answer. Yes, but this is text A. In text A, where you can find the answer, please? Where is? No, there is no mention of where a pet should urinate. Okay. So you should go for treatment and prevention. Okay. Treatment and prevention. Try to find here. The question is, This is your question. Where a pet should urinate? This is the question. Try to find the answer here in this text, okay? No, urban areas, no. The answer is not in text A. The answer is not in text A. Your answer is in text D. Your answer is in text D. Just let me know where you can find the answer in text D. This is the answer. Encourage your dog to urinate away from standing water or areas where people or other animals will have access. Okay. So this is where your dog means your pet. Okay. So where a pet should urinate, this is the second last bullet point. Okay. Yes, Miss Uma, yes. Dr. Sajid, yes. Okay. So this is where we should. Okay. So the next question is classification of leptospirosis according to skin color. In which text we can find this classification of leptospirosis according to skin color? Dog to unit away from standing water. Yes, the answer for question 1 is text D. Okay. Classification. Question number 2, classification of leptospirosis according to skin color. Okay. In which text? In which text you can find answer to text question number 2, where we can find the answer? In which text? In which text you can find the answer? In which text? Quickly, please, quickly. Don't wait for the others to answer. Just quickly answer, please. Okay, in which text you can find the answer to question number 2? A or B, maybe and C, A, B, C, okay? It can be anywhere. A, B, C, D, okay? So let us copy. This is your text A, okay? This is your text A. This is your question, okay? Let me know if you can find the answer here in text A. Let me know if you can find the answer in text A. Let me know if you can find the answer in text A. No? This is classification, 2 types of leptospirosis. This is classification. No? Okay. Then text B, pathophysiology. Here you can find the classification. In text B, you can find the classification. In text, in B. No. In text B, no. Okay. Try in C. Text C. If you cannot find in text C, let us go to D, okay? Text C. Miss Radha, mild leptospirosis and severe leptospirosis, that is your answer. No, that is wrong. Miss Radha, that is wrong. Okay, so if you cannot find in C, let us go to D. In text D, we're talking about treatment and prevention. So we have two possibilities. We have two possibilities, ecteric or anicteric, ecteric or anicteric, and here is mild and severe. In mild and severe, they are not talking about skin color. You can see here, they are not talking about skin color. If you go to ecteric and anicteric, here is, yes, of course, skin color. Okay. Ecteric and anicteric, it is according to skin color. Okay. So here you have paleness in ecteric, and in anicteric, you don't have pale color. Okay. So the answer is text C. Okay. B no, A no. In text A, we're talking about mild and severe, and here there is no mention of classification according to skin color. Ecteria and ecteria, no. That is why the answer is there is no other classification throughout the text. There is only one other place where we have a classification. Ecteric and anicteric, and this is according to skin color. Okay. This is just overall meaning. There's no exact word skin color. You can just find. Okay. So the answer is text C, not A. Okay. Little bit tricky. Little bit tricky, but the examiner cannot give straightforward questions. We need to twist. This is my own sample. This is my own sample. So we need to twist a little bit information so that we can check who is ready for the exam, who is not ready. Okay. Effects of leptospirosis on unborn babies. Effects of leptospirosis on unborn babies. In which text we can find the answer? Effects of leptospirosis on unborn babies. In which text? Let us go to C. Okay, this is your text C. Try to find the answer here, please. Okay, is there any mention of effect of leptospirosis on unborn babies? Is there any mention in text C? You can find the answer in text C. Just please let me know if you can find the answer in text C. Are you able to find the answer in text C? I think no, there is no mention of unborn babies here, no. So then we should go for B or D. B, okay, let us go for B. Try to find the answer and let me know in which paragraph you can find it. This is paragraph 1, 2, 3, and 4. There are 4 paragraphs. Try to find the answer, please. And let me copy the question here. This is the question. This is the question. If you cannot find the answer, then we can move to other text, okay? So you people are saying we should go for text D because here they are not mentioned unborn babies. So let us go for D. Okay, so try to find in D where you can find the answer in D. Somebody is asking the answer is in D. Where you can find the answer in D? In which paragraph? In which paragraph you can find the answer in D? In D, no antibiotics, kidney, liver, dogs. So family is still a risk diagnosed. Okay, this is the prevention that what we need to do. There is no mention in D, no. In C, no. It can be in A or B. Okay. So here in B, where in B, in which paragraph? Second paragraph, not in B. Okay, so the answer is here. This is the answer. Yes, second paragraph, last line. If infected during the third trimester, pregnancy can result in stillbirth or intrauterine death. Okay. If infected during the third trimester, pregnancy can result in stillbirth or intrauterine death. If infected during the third trimester, pregnancy can result in stillbirth or intrauterine death. Okay, this is unborn baby. Okay, stillbirth, it is not born. His mother's, okay, in mother's abdomen, in mother's uterus. Okay, intrauterine means still it is not born. Okay, I will not directly tell you that the baby who is in utero, so intrauterine death. Okay, effects of leptospirosis on on pregnancy. I will not directly give the question like this. I will twist it a little bit. Okay, effects of leptospirosis on unborn babies. So in that way, I can uh, you know I can find some students who will answer wrong. Okay. So please keep in mind that the examiner will not give you a piece of cake, okay? A mention of a research, where it is mentioned a research, where it is possible, where you can find a research, a research, where it is possible. Text A, okay, let us go to text A. The question is mention of a research, okay? So here, no mention of research in types of leptospirosis, there is no mention of research. So here in the picture, try to find if there is any mention of research. If you can find the answer here, we can move to other text, okay? No mention of a research, okay? There is no mention of research. Pathophysiology. Okay, let us go. Okay, here in pathophysiology, is there any mention of research? In B, is there any mention of research? In text B, can you find any mention of research? Any research here? No research? Okay, so let us go for C. History and physical symptoms, whatever. Is there any mention of any study, any research here in text C? In text C, please let me know in the chat, please. Historically is not a study. Historically is not a study. Okay, there is no mention of any study here. Text D. Text D. Is there any mention of any study here? Yeah, they're talking about treatment here, leptospirosis in dogs. Here, just nothing diagnosed, and here is the prevention. Is there any mention of prevention? Sorry, a study. Any study is mentioned here in text D? No? If no, then where we can find the answer? The question is mention of a research. What are synonyms of research? Anybody can write synonyms of research in the chat? Synonyms of research in chat, please. Okay, any other synonym of research? Synonyms of research, please. Please participate actively. Otherwise, I think we should stop the class. If you cannot participate actively, then there is no need to waste your time and my time. Okay. What are synonyms of research? Study, any other thing? Okay. So there are different possible. Now try to find here, please, if you can find any. Make it a little bit smaller. Try to find here, please. Okay. Any case study, cohort, research. investigation. Okay, there are different possibilities. Yes, okay, you can see here, it is written here in one study, 80% of dogs with leptospirosis had increased liver enzyme levels. Okay, so this is the answer. Answer is here. Okay, no problem, Dr. Hirani. That is not a problem. Okay, so this is the mention of a research. Okay, so this question is not difficult, but you will waste your time. You will try to find here and there in text A, B, C, and D. At the end, you will spend a lot of time, and this is also very important thing because when you spend a lot of time, okay, not too tricky, but you will spend time. You will spend time, and when you don't have time for the last questions, then you will lose marks. Okay, even if you will answer this question, you will, if you don't do it quickly, you will lose your waste your time. Okay. Survival rate after effective treatment. In which text it is possible? Survival rate after effective treatment. In which text it is possible? Survival rate after effective treatment. In which text? Let us go for D. Most of you are saying D. Sorry. In text D. So here is your question. Survival rate after effective treatment. Try to find the answer, please. Okay. So which paragraph is the answer? Survival rate after effective treatment. In which text? In which paragraph you can find the answer? If you find the text is a little bit, short, you can rotate your mobile. You will see little bit long text. Okay, large text. Second para, first line. Okay. Currently available vaccines effectively prevent leptospirosis and prevent dogs for at least 12 months. Survival rate after effective treatment. This is a treatment or this is just prevention? This is just vaccination. The answer is not in text D, where we should go. Text D, no. The answer is not in text D, where we should go. Where we should go. Oh, try to find here, please. Try to find here. Can you find in text A? Can you find the answer in text A? Yes, here more than 80%, okay? Survival rate with treatment are reported to be more than 80%. So the answer is text A, okay? The answer is text A, not D, okay? You can see how the tricky things can be, okay? Type or types of medication to use for treatment of leptospirosis in which text? Type or types of medication to use for the treatment of leptospirosis in which text? In which text you can find the answer? So in which text we can find? Let us go for D. Most of you are saying in text D. Okay, can you find the answer here? This is your question, the last one. This is, sorry, this is your question. Where is the answer? In which paragraph? The answer is here, okay? Treated with antibiotics and supportive care, okay? These are types of medication, okay? Types of medication, just, antibiotics. These are types of medication, okay? The answer is test D, okay? The last one, source of infection for most of dogs in cities. What is the source of infection for most of the dogs in cities? In which text it is possible? In which text? Source of infection for most of the dogs in cities. In which text it is possible to find the answer to this question? In which text you can find the answer? Okay, text A. Okay, let us try. Most of you are saying text A. Let us go for A. Okay. Here is your question. Source of infection for most of the dogs in cities. If it is fill in the blank, what you will write? If it is fill in the blank, what you will write? Just fill in this blank. Fill in the blank. Okay. Fill in the blank. Just tell me what is we need text A, B, or C, or D. Just fill in the blank, please. Fill in the blank. Okay, one answer is slow moving or stringent water. Okay. This is one answer. Infected rodent urine. This is another answer. In urban is third. In urban area. Dr. Najwa, why urban area? Why urban area? So the answer is here. Dogs in urban areas. Urban areas already written. Urban areas mean cities. Okay. Urban areas mean cities. uh, For most of the dogs, okay, dogs in urban areas are mostly mean most of the dogs. Okay, mostly most of the dogs. We can change it mostly. Okay, infected through contact with infected rodent urine. Okay, source of infection for most of the dogs in cities is infected rodent urine. Okay, this is the answer. Infected rodent urine. This is the answer. Okay, just I am paraphrasing. Okay, paraphrasing the just paraphrasing. Okay, so this is how the examiner will change the things so that you people can be tricked. Okay, never, the examiner will never give things straightforward. Okay, straightforward though. So when you do reading samples, part A, B, C, so always try to critically think. Okay, as we have done in the reading course. So most of my students have learned a lot of things with my samples, and a lot of things we have discussed. So we analyze things. Okay, critically analyze. We analyze things critically, why it is true, why it is wrong, where we can find the answer, all of these things. We have completed our reading course in the last month, and nowadays I am not taking any reading classes as I am busy for next 2 or 3 months. If any of you is interested in reading and writing course that is also available for a few days, then I will not be taking writing students also. So if you are interested in writing course, it is very good course. So a lot of students have passed after joining this course, almost 90 to 100%, between 90, 95, 100% result. So we have daily lectures plus 14 letter corrections different types of letters: referral, urgent, discharge letters, non-medical professionals, letter to non-medical professionals, pediatric patient, two patients in one letter, GP to GP transfer, or in case of nurses, community nurse to community nurse transfer. So the course is in 100 British pound. After 30% discount, it would be 70 British pound. Okay. So if you are interested, please try to join as soon as possible, because maybe in upcoming days, I will not be taking new students. Okay. Speaking is not available. Reading classes are not available because I'm too busy these days. Only writing is available if you people want to join. Okay. Writing classes are available. Speaking, no, because I am preparing for my own exam. I don't have time. That is why I am not taking reading classes also. So only writing courses available. That is also available for a limited time. Okay. So the answer to the last question was this one: infected rodent urine. Actually, the answer is text A, because here in the I'm asking about which text. Okay. The text is A, but if we fill in the blank, it is infected rodent urine. Okay. So if any of you are interested in writing course, you people can join. If any of your friends is interested in writing course, you can join. Okay. So because it is would be available for a limited time, then I will not be taking new students for writing course. Reading course, I have already stopped it. Speaking is almost not available. So only writing is available. Thank you so much. If you have any question, you can text me. Okay. If any of you is not in my WhatsApp group, okay. If any of you is not in my WhatsApp group, please let me know. I can add you in my WhatsApp group, so that whenever I plan for a free class, you will be notified. I will put the link to the live session in that group. Thank you so much.